Data collection is a very important part of our operations. Since 2017, we have been developing our own customized software where we record data on a daily basis. And with this data, we're able to do elaborate analysis of a lot of impact that we have created. The last financial year, we have managed more than 20,000 tons of waste, most of it being low-value plastic, which would have otherwise been dumped or burnt. A dual revenue model helps us work with maximum compliances when it comes to responsible waste management methods. We recover more than 96% of all the waste we manage. And when it comes to social impact, more than 80% of our team are from the base of the pyramid.
Before collecting the data, we have to work with something called the decision-making questions. Questions such as, how much is a worker willing to pay? For example, in the case of the hygiene products, how much are they willing to pay for that? The next step is identify the relevant indicators which will help us with the data collection. Next, we proceeded with the survey to directly interact with the stakeholders, in this case, of course, our workers. And then this will help us understand the impact. For example, 83% of the women reported that they did not have access or they were not absolutely using the hygiene products before Bandhan was there. So we have contributed to SDGs 3 and SDG 1. 94% of the workers stated they did not have good alternatives to Bandhan Fair Price Shop. 97% of the workers stated that they are able to save more money because of the reduction of prices due to Bandhan Fair Price Shop. And a further 98% of the workers stated that they were doing much better than other people. As they're going back to the community, they can do the comparison. What the Impact Lab allows us to do is deep diving. The Poverty Probability Index helps us understand the impact of our inclusive business model, not just within the company, but in the economy in overall. It also helps us improve our inclusive business performance. Because within the BCTF portal, we have other case studies. So this gives us the learning and opportunities that we have to adopt newer models within the company. And this helps us contribute further to Bangladesh with different SDGs. Thank you.
We conduct also surveys before and after the intervention with the community health leaders to identify the development of new skills and the impact of their activities in their communities. And finally, we surveyed the 10 healthcare professionals trained by the project to identify their satisfaction with the training and also the new knowledge acquired as part of the course. As a result of this strategy, 95% of the women referred to improve their knowledge in healthcare lifestyles, and 68% reported to start implementing the breast self-examination with the correct technique. The impact management process enables us to identify two main impacts of Mujer Vive Tu Salud project. The first one, improving access to healthcare services for communities that otherwise would not access to them. For instance, 40% of the women who participate in the project had an outstanding remission for breast or cervical cancer services and has not done before because several barriers of the health system and long distance for accessing the healthcare services.
We always systematically, with every factory we start working with, is we create a baseline from which to measure our success. And this has got factual data in it, including number of jobs, split by gender, that kind of thing. But we also do worker interviews and focus groups to get direct feedback from workers around their needs and what is important to them.
We designed an impact value chain that was very clear, but also came up with ways of measuring that impact. And we did a survey where we were targeting 300 smallholder farmers across our business. Within the feedback, we found out that a lot of the smallholder farmers now within our business have access to credit. And 70% of the farmers said, talked to us and said because of our initiatives, they're able to access credit at affordable and reliable status.
BIMS helped us through a structured way to take feedback from a variety of stakeholders. That's community, teachers, parents, students. We've used the BIMS study to make policy impact. We've shared this at various interventions, and it has helped us strengthen our own framework. So we have our own reach out center, our own call center that calls students and tracks their progress, counsels them, monitors, reviews across the entire value chain. 2019, when BCTA again, and we are very thankful to BCTA for helping us become impact champions, we saw this as another great opportunity to see what is the way now we can measure our contribution towards the SDG goals.